My name is Wendy McGrandles. I qualified from Glasgow in 1983, and after several years in mixed practice in Northern Ireland, I decided to set up my own practice back in my hometown of Glasgow. Glenbrae Veterinary Clinic was set up in 1990, originally as a small animal and equine practice. It has now grown into a 5-vet, 2-centre, 100% small animal practice, providing the most up-to-date conventional and holistic treatment. My team of vets use an integrated approach, backed up with modern diagnostic procedures, in order to treat each case in a much more individualised manner and to give clients educated choices as to how to proceed with each case. When I first graduated, I was working mainly in a large animal practice, and I didn't get much opportunity as a new graduate to prescribe homeopathy in my cases. However, I would often suggest to farmers things that they could use along with their conventional treatment, and it was just at the time that mastitis nosodes were becoming available commercially. Several of my dairy farmers used them under my direction, and they found that their use of dry cow tubes decreased hugely, and also that their cell counts fell within the farm environment. Homeopathy teaches you to view disease in a different way. With increasing specialisation in conventional medicine, the body is often seen as different compartments: heart, kidney, liver, musculoskeletal system, and so on. Symptoms are recognised, but treatment is aimed at taking the symptom or sign away, usually by suppression. For instance, an atopic dog with severe itching will be given a drug to suppress the itch. Over time, the dose usually has to be increased or combined with more immunosuppressive treatments. With homeopathy, signs and symptoms are seen as the body's way of expressing an imbalance, and taking this expression away or hiding it often creates pathology at a much deeper level. Homeopathy looks at all the signs and symptoms and the organism as a whole. It takes into account mental, emotional and behavioural changes, likes, dislikes, fears, phobias, heat and cold preferences, anything that individualises the patient and the symptoms that we see. Once all the information is gathered, a remedy or medicine is then prescribed. The medicine is aimed at allowing the body's own energy levels to correct the imbalance that caused the disease state in the first instance. A homeopathic consultation differs from a conventional consultation mainly because it's a lot longer. The first consultation is usually an hour, and I use a different room from my normal consultations. It allows the client to have a soft seat for a start, and for the animal to be allowed off its lead, or if it's a cat, to come out of its basket and wander around in a more relaxed environment so that I can watch its behaviour and I can start to get a feel for the patient in front of me. Once all this information is gathered, and it can be a huge volume of information, I use a computer repertory, which is a piece of software that gathers together all the relevant information and gives me a list of homeopathic remedies that may be suitable for that individual case. However, it's not as easy as that. It's not the computer that chooses the remedy to be prescribed. It's down to the skill of the homeopath, who understands the materia medica and can choose the remedy best suited to that individual case from the list selected by the computer.
Col is an 8.5-year-old German Shepherd that was bred through the police breeding programme. The last year of his working life he had sores, dermatitis in his paws. It started in his body and ended up in between his paws and his pads, and he was on various antibiotics, and what happened was it was clear for 4 weeks, and then the next stage it was 3 weeks, and then he was on antibiotics, and then it was 2 weeks. So the timeline between each flare-up was getting less and less, so he was almost in permanent discomfort with these open sores and wounds between his pads and his feet. We came and saw Wendy when he retired because of the constant flare-up. We then had a look at his whole history, and one batch of treatment over 2 weeks took the sores away, and he's had no flare-up in that year.
The types of cases I treat with homeopathy are many and varied, and in fact I believe that most things can be treated homeopathically. Now, it goes without saying, if you've got a fracture, a cruciate rupture, a gastric torsion, a foreign body, you're going to require surgery. But homeopathy can help in these cases also with the post-operative recovery period from anaesthetic and the wound healing involved. As far as medical conditions are concerned, most are amenable to some sort of homeopathic intervention. I tend to treat mostly skin disease. I treat a lot of allergies. I also think that things like inflammatory bowel disease respond extremely well to homeopathy. However, a specific area of interest is in cancer treatment, where we can offer support to people whose animals have been through radiotherapy and chemotherapy, or treating these diseases in their own rights. We can offer a supportive service with palliative care. I also treat a large number of geriatric animals who are struggling to cope with the side effects of conventional treatment, and these may be cases of osteoarthritis, musculoskeletal weakness, urinary incontinence. Most things can be helped with homeopathy.
If it weren't for the homeopathy, I would doubt whether Col would still be here now. I think the quality of life that he had was non-existent because every step he took was painful because of the open wounds and sores. So if it wasn't for homeopathy, I don't think he'd be here.
If homeopathy didn't work, my clients would not come back for more.
People will tell me that homeopathy is on the mind, there's a placebo effect. I don't know how you can tell a dog has got a placebo effect. I've had 4 dogs who have all been treated by homeopathy. Every one has got better or been given a quality of life that they didn't have before. So if somebody can convince me that there is a placebo effect in that or homeopathy doesn't work, then please tell me.
I became a vet to make animals better. I find using solely conventional treatment limits my success rates. Homeopathy adds an extra dimension to my practice. Yes, it's often more complicated, but actually hugely satisfying as a clinician to see animals responding to these forms of treatment.